Yeah. Okay, your middle name is Macho. But I'm wondering if you ever cry. Has Macho Man ever cried?
Oh, yeah.
Really?
Uh-huh. It's okay for macho men to show every emotion available right there, you know, because I've cried 1,000 times, I'm gonna cry some more. Yeah. But I've soared with the eagles, and I've slithered with the snakes, and I've been everywhere in between, and I'm gonna tell you something right now. There's one guarantee in life, and that there are no guarantees, yeah. And understand this. Yeah. Nobody likes a quitter. Nobody said life was easy, so if you get knocked down, take the standing 8 count, get back up, and fight again. And you're a macho maniac. Dig it.
Oh, I dig it, Mach. Thank you. That's the Macho Man, Randy Savage. May he rest in peace, but his spirit lives on within each and every one of us. And I don't just say that because I'm wearing a brightly colored shirt that one would expect to see in the 90s. But hey guys, what's going on? Memes here. So apparently the president has declared a state of emergency. As you can see, I am a semi-translucent being right now because we're mucking around with a little green screen. It's trying another little setup here. We'll see what happens. Maybe we'll tweak it lightly. But yeah, the president said some words today. I just kind of want to go over, give a little active commentary. Let's see what we going on. If we have anybody in the chat, oh, maybe I should actually share the stream out. This could be, oh, this is why we have bonus technology. All right, now I need to cover up the live control room because that freaking creeps me the heck out, man. The funny thing is, it's like, oh, you put up a stream before. It's what's going on? Oh, look, it's going into an old ingest server. I'm on this thing. I'm waiting for it to load up. Oh, it's already broadcasting. People are watching. Ooh, well, it's a good thing nobody's ever done that before. So, what do? We hippity dee 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 dee. Don't mind. I just dislike dead air. That's the thing. If nothing's going on, oh, I'm not a big fan of listening to it, and I just hate when it happens as well. Ooh, it's literally me with the Macho Man on the screen capture. That's kind of cool. All right. We'll pop in here. I'm sure nobody's got anything better to do. We copy the link there. We go into the other internet realms because apparently there's things where you can do this, but it costs a bunch of money, and we'll see if we can do it maybe a little cheaper. Let's see what the heck's going on. I mean, this is why I stand by. This is the modern memes of production. That's why we need digital due process to help protect ourselves. Because if all of a sudden people start taking all these things away and these are integral parts of life, I don't know. Is this the future? The internet and IRL seem to be combining. How will we handle it? Is anybody out there? I don't even know. It's okay. And I'm sure in hundreds or thousands of years, if we don't manage to destroy ourselves or Mother Nature strikes back too much, internet archaeologists and paleontologists will be delving through the net because we must remember rule 2 of the internet. The internet is forever. That's just how these things work. Did I tweet out? Oh wait, I don't even think I have a link. Yeah, that's right. We're simply doing this. We don't need to think about it too much because sometimes thinking can be hard. It can also be very fun. All right, I tweeted the correct thing out. Why the heck not? Oh, you know what? Screw it. I'm getting sick and tired of these separations of this and that. Sometimes you just gotta do it. Why? Why the hell not? Because we can, a wise man once said. So, all I know is, hey, it is what it is. All right, so as we know, President Trump, he's given some remarks. He said some words today, and let's see what we got. So, Keisha, hello. Let me know if the president's audio is coming through. I just want to make sure. It should be working on OBS.
Beautiful day in the Rose Garden. Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking.
Is the president's audio coming through?
Effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done
Let me check.
to other areas of the world,
All right, we're
it's,
coming through.
it's pretty incredible. A lot of that
All right.
had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago.
All right, so
that
the
was
president's going through protocols
lucky or
of
through
cutting
talent
off
or through luck,
standard travel
or
through
whatever you want.
nations. He
But
did
through a
China
very
early,
collective
Europe
action
recently.
and
I know
shared
during this he said he
sacrifice,
may
national
do the UK.
determination, we will overcome the threat of the virus. I also announced Wednesday night,
Okay.
following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States.
No, a lot of folks are
Citizens,
concerned
permanent
about folks
residents,
that
and our
live here,
families.
Americans.
Any of the families returning from Europe will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today,
Okay. So
many
even
of the
American
things that
citizens
what
have
we
to be
said
checked in
were
protocols, okay,
100%
during a pandemic.
correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what
Folks
we're
would
really
argue
doing, and now we're
About the earliness
in a
of it,
different
but
phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They
this
were
is
in
a
place
part
for a
that
long time, and we're breaking them down now.
does kind of
And they're very
concern
usable
me.
for certain instances, but not for this. To
Shows
unleash
we
the
should
full
have had
power
other
of the federal
protocols
government
then.
in this effort today, I am officially declaring a national emergency. Two very big words.
It's very big.
The action I am taking will open up access to up to $50 billion of very important and a large amount of
So
money
additional
for states
$50
and
billion
territories
of
and
funding
localities in
provided
our shared
via
fight
federal
against
assistance.
this disease.
I was down in
In
Florida when they
furtherance of the
declared
order,
that
I'm urging
Governor
every
Baker 8
state to
hours
set
later
up
up here.
emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right
It's got like
behind me
Walmart,
and the side of me.
Walgreens.
I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various
folks-
other places are also very engaged. I just spoke
Folks
with
aren't effing around.
Governor Cuomo. We had a
Apparently
very
up
good
here we're shutting down
conversation.
for 2 weeks
And
starting
we're
Monday.
working very strongly with many states, including New York.
That's scary and stuff. I mean,
The
if you
emergency
weren't around
orders
during
I'm
9/11
issuing
and
today
just
will also confer
remember
broad new
those
authority
severe
to the
traumatic
Secretary
emotional
of Health and
moments,
Human
it's-
Services.
this might be
The
the kind
Secretary
of first
of
thing where it's like, oh
HHS
my
will
God,
be
what's
able to
actually
immediately
happening
waive
since then? I don't
provisions
know.
of applicable laws and regulations to give doctors,
At least
hospital,
on an entire country
all
scale that
hospitals,
many people.
and
I
healthcare
don't know, it's
providers
tough.
maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable
Hey, Obi-Wan.
telehealth,
Monterey.
a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and
Double-edged
hospital
sword.
check-ins
Seeing somebody is different,
power
but for certain things,
to waive certain federal license requirements so
It's
that
that
doctors
balance.
from
Where do
other
you find
states
it?
can provide services in states with the greatest need. Number two,
we should have options,
the
but
ability
also
to
let
waive
folks know.
requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board, or obtain needed office space. They can do as
serious
they want.
problems
They can do
require
what they
serious
have to do.
responses very often.
They know what they have to do.
The waiving of
Now they don't
laws
have
willy-nilly, I'm like,
Problem getting it done.
how is
The
this
authority
set
to
up?
waive
How
rules
is
that
the
severely
president
restrict
able
where
to do
hospitals
this?
can
Is
care
it
for
under
patients within the hospital itself,
the
ensuring
act that
that
he's
the emergency
initiating?
capacity can be quickly
Just because even if
established.
this happens to be for a good thing,
We'll
what happens if
remove
it
or
goes the other
eliminate
way?
every obstacle necessary to deliver our people the care that they need
It's emergency management powers,
and
and
that they're
okay.
entitled to.
Just
No
people
resource
should
will
be aware
be
these
spared.
powers exist. That's
Nothing
all I'm saying.
whatsoever. 10 days ago,
Just
I brought
in
together the
case they go in
CEOs
another
of
direction.
commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests.
Okay, that's
Other
good. A lot of folks have
countries
criticized,
have
saying
called
that,
us
well,
and
you probably
worked with
should have
us,
done
and
this
they're
a bit earlier.
doing similar
Maybe
things
there were
or
things
will
behind
be
the
doing
scenes. I
similar
don't know. Was
things.
it
As a
this red
result
tape
of
that was in the
action,
way?
Today we're announcing
A little
a
later
new
on, he goes
partnership
into
with
some
private
other
sector
factors
to
as well.
vastly
I may
increase
have already listened
and
to it.
accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if
I don't want to share out
if
my
we
stream key.
feel
That might be
that
bad.
they shouldn't be doing it. And we don't
Copy
want
the wrong
everyone
thing.
running out and taking only
These
if you
things
have
happen. Don't worry.
certain symptoms. Using federal emergency
Mm-hmm.
authorities, the FDA approved a new test for the virus. We did this within hours after receiving the
such a
application
noob.
from Roche, a process
All
that
right.
would normally take weeks.
Hey, Keely,
We
Mitch.
therefore expect up to 500,000 additional
It's
tests
happening.
will be available early next week.
False. Yeah.
We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their
See,
incredible work. I'd
I'm just
also like
thinking
to
a lot of the
thank
folks
Thermo
that, like,
Fisher. The FDA's
I still remember
goal
being
is
in
to
Latin too and hearing the
hopefully
announcement for
authorize the
9/11.
application
It's just
within
like you heard both
24
those things.
hours.
All right,
It'll go very
something's going
quickly.
on.
It's going
I'm
very
like,
quickly,
oh, well, this is obviously World War
which
III,
will bring
or is it?
additionally
It-
1.4
it's that feeling. You
million
don't know what's
tests
going to
on board
happen.
next week.
And if
And
a lot of
5
young
million
folks
within
now,
a month, I
if
doubt
they
we'll
weren't
need
around for
anywhere
that,
near
like
that.
this would probably be the
At the same
closest thing
time,
I
we've
could
been
think
in
to like maybe what we
discussions with
felt.
pharmacies and retailers
It
to
was
make
pretty freaking terrifying.
drive-through
like, oh,
tests
are they just
available
gonna
in
get
the
launched? People like,
critical
oh,
location. I want to
I,
thank
I,
Google.
I thought
Google
President
is
Trump and
helping
they were
to
free
develop
speech,
a
so
website. It's going to be
if I don't do enough
very
fair use,
quickly done.
I like to think this is a message they want to
unlike
disseminate.
websites
I don't
of the
know.
past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover
there are a lot of folks
this
stepping
country
up,
in
but
large parts of the
Sometimes
world, by
it
the way.
takes
We're not
when
going to be talking
times
about
to
the
be at their
world right
worst
now,
for folks to
but
be
we
at their
cover
best.
very strongly
Shouldn't
our
have to be
country.
that way, but I think it's that whole
Stores in virtually every location.
story of humanity. It was a story of humanity.
Google has 1,700 engineers working on this right now. They've
Right?
made
No, no,
tremendous
no, no.
progress.
They helped
Our
set up a
overriding
site.
goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary.
I mean, this
will
is history
pass.
right here.
This will pass
I mean, you
through
could say
and
politics this you want, but I mean, this
we're
is
gonna be,
establishing historic
stronger
precedent,
for it.
drawing from it.
we've learned a lot.
I don't
tremendous
remember the
amount
last
has
time
been,
we
I wanna thank,
shut down the country
Deborah
for at
Birx,
least
and I want to ask
2
her
weeks
maybe to
because of a state of
come up and say a
emergency.
few words as to
I hear
what's
things like this have
happening.
happened
Dr.
before.
Birx
On this
is
scale?
a highly respected person. I've gotten to know
I don't know,
very well
man.
over the last
I don't know.
6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Yeah, the
Thank you, Mr.
transmittability, the
President. It's
virulity
a
of
pleasure
this
to
is
be here with all of you.
all
I
over
think
the
you
place.
know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system.
okay.
But last Tuesday, seeing the spread of the virus around the globe,
Right.
the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high
And then
through
go from like a
quality
cheek to a
platform
nasal
that can
swab
meet
or
the needs of the
something.
American public. We are
That was
grateful
like a
to
multi-phase
LabCorp and Quest
test.
for taking
That
up
might
the
explain
charge
why
immediately
initial
after
tests
the
weren't
meeting,
as accurate,
and
so we
within
were getting
17
false
hours,
positives and
72
false
hours,
negatives,
bringing
which
additional testing access,
leaves
particularly
even
to
more
outbreak
uncertainty, which
areas
gets people more
of
scared.
Washington State
Sorry.
and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes
Is it
those
the
drive-through options
multi-diagnostic?
that have been made available through these high-throughput options. Following the meeting last
I don't
week,
know, what
major
will we
commercial
find out, folks?
laboratory equipment and
It's
diagnostic
you and me.
companies
Let's
took
figure this
immediate
stuff out
action
together.
to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands
Well,
of
$50
Americans
billion is a
within
lot for the
short
private
turnaround
sector
times.
and pretty much
In
any
less than
sector
2
there,
weeks
so
together, we have
people are
developed a
concerned
solution
about
that we
other
believe
things
will
that
meet
aren't
the
going
future
through.
testing needs of Americans.
okay.
I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is
Well, that's the
because
thing,
of the
it is
lessons
the
learned
fear.
from that we were able to
How does it
mobilize
transmit? What
and bring
happens?
those individuals that were key to the HIV response to this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people.
Okay, no, all that stuff does
But
happen,
this
but it's
intense
just
effort has not
people,
only resulted in
people have
innovative
concerns.
solutions, but an automated, high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed.
What, was it a
Finally,
lack
I
of
want
tests
you
or
to know
lack
in
of
South
accurate
Korea,
tests?
They did have large
'Cause
number
both those
of
things
tests
sound bad.
available over the last several weeks. Their positivity rate is between 3 and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1 and 2%. So we want
That's
to
more
also
accurate?
announce this new approach to testing,
Okay.
which will start in the screening website up here,
All right.
facilitated by Google, where
Thank you,
clients
Google.
and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes.
Mm-hmm.
They would move down this and be told where the drive-through options would be for them to receive this test.
Okay.
The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours.
So is
That
this
the
part of the
intent
ramping
this
up, like,
approach. We've seen
of,
it work
because
just
MC was
in our
talking
own
about,
United States,
we have
and
the
we wanna
ability
bring
to
this
retool
across
all of our
the
systems to
continent.
crank out
Thank you very much.
manufacturing. So, I mean, can we now do this with testing and stuff? I mean, go us if that's
I'd like
the case.
to maybe have Tony. Do you want to come up? You become I think everybody out here knows
Oh,
you
sorry.
pretty well, but Tony's been doing a tremendous job working
What else we got going on?
long hours, and you've seen a lot
Sorry, I've
happen.
been
but
slacking.
This has been, it's been a great experience, and working with you has been terrific.
Right,
Tony,
right.
please.
Thank you very much, Mr.
Well,
President.
Well, that's the
This
thing.
is an
Spanish
example
flu.
of another example.
We also have a lot
of
more medical
what
technology,
I've
and I
been
feel
referring
like
to in my discussions with many of you in the audience.
I think some
as
modern
a
medicine has kind of made us
proactive,
a little
leaning
lazy in
forward,
some ways.
aggressive,
Just the
trying
old
to
things
stay
like
ahead
covering
of the curve.
your
And what you're
mouth, you
seeing
cough,
now
you
with this
sneeze,
order
stuff like that. Wash
is
your
that
hands
we're going
multiple
to be
times
able
throughout
to
the
remove
amount
the
of times I touch
constraints
my
so
beard or
that
your face
people
or
at the
something.
state, the
a lot of
local
folks don't
level,
know.
the individual physician, all the way up through the federal government, will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the
Everyone wants to
mitigation.
do everything possible,
so that, as
but
I've
it's
said many
just
times, that curve that I referred to that goes
we're
up,
able to do
we
this
don't want to have that
because
curve.
of the state of
We want to
emergency.
suppress it down to that small mound. And I think what we've done today
Well, that's the thing.
is
People,
something
there are a lot of
that is gonna
people
be a
that are very
important element
have underlying
in having us
conditions
be
or might
successful
be
in
sick
doing that.
normally,
We still
and
have
if
a
all of
long
a sudden
way to
you
go.
get
There
an
will be
extra
many
500,000
more
people
cases,
sick
but
all
we'll
at
take
once,
care of that. And ultimately,
then
as the president said, this will
then
end.
you could have some
but what's
issues.
going on here today is going to help it to end sooner than it would have. Thank you.
All right, thank you.
Thank you very much, Tony. If I could,
ASSM.
Some of these folks we know, they're celebrities in their own right. They're the biggest business people, the
When
greatest
when I
retailers
interviewed
anywhere in the world.
the
And
young lady
one of
from
them
Hong
is Doug
Kong, she
McMillan
said
from
that
Walmart, and I'd like to have Doug,
one
if
individual
you would say a few
was
words,
infected in
wherever
her
you would be.
office by her boss that literally had just walked by or
When
something.
we
So
got
I
the
mean,
call
that would
yesterday from the
lean
White
to
House, we
the
were eager to
thought
do
that
our
it is
part to
also
help serve the
airborne.
country, and given
that's
what
the
we're
thing.
facing, that's certainly
Highly
important, and we should
contagious,
all be doing that.
and if it
So we've been asked
lasts
to make
for a while
portions of our
before the
parking lot
virus
available in
dies,
select locations in the beginning, and
and then
scaling
if somebody
over
coughs or
time
sneezes
as
on their
supply
hand, they touch a
increases,
doorknob.
so that people can
It's
experience
kind of
the
like
drive-through
measles,
experience that
highly
the president
contagious, sticks
described.
there for a
We'll stay
while,
involved and do everything we
but
can from a supply chain point of view to
it
be of
also
assistance. Thanks,
has
sir.
that airborne factor as well.
Very much. I'll just stay right over
So-
here. And Richard, if you could come up, please.
I mean, I tend to think that most folks over the period one getting at some point or another,
Thank
it's
you, Mr.
just
President. And
you don't want
similar
anyone to
to,
get sick
to
at
Doug
once
and
because
Walmart, we're,
an extra half a
happy
million
to
sick
stand in
people,
here and help in communities
then all of a sudden,
all across
plus
America,
everyone
'cause a
else
lot of
that's
times when
normally
we
sick,
have natural disasters,
folks don't get the resources
our
they
stores
need, like
are
a respirator
beacon
or
in the
something.
community,
That's
and this
unfortunately
situation
how
is no
people
different.
pass.
So we look forward to partnering with
The thing is,
CDC, the
if
administration,
everyone gets sick over
HHS,
the next
and the task force, and
year
specifically to
or
the vice
so,
president's doing such a
then,
fantastic job. We're
okay,
ready to
we have
engage and help.
resources over a period of time.
Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
I mean,
Well,
the
Mr.
weirdest
President,
thing I
thank
can
you
think
for
of right now, it's
inviting us
kind of
here
like,
today,
all
along
right,
with our colleagues
you're trying to
from
funnel a
Walmart
beer
and
through a
Walgreens and
straw.
our partners at
You only get
CVS.
so much at once.
Normally, you do
If you funnel it all at once,
but
you're also going to get
today,
very intoxicated.
We're focused on a common
If over
goal,
time,
and that's defeating
lasts longer.
the spread of the coronavirus.
So I think some of those
And we look
cocktail
forward to
drinks
working
need a
with the
little straws.
administration to do our fair share to alleviate this growing threat. So
realize that was the worst
thank you for
analogy in the
including us
world.
today. In the near term,
it happened.
we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials.
Basically,
key food and
closing down
beverage
pretty much
items
everything
they need
except
during
like
this time,
pharmacies
making sure
and
we run safe
supermarkets.
stores
That's what I heard
and create an
locally.
environment that's safe for our team members,
In a hurry.
making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Poland? Tom Paul? Please.
Oh,
Thank you, Mr. President. As
I'm not good
CEO
at
of
converting
Becton Dickinson,
Celsius,
we're
but
one
that
of the
looks
leading,
high.
providers of medical devices as well as
I mean, I think
collection.
schools-
Thank you,
okay.
Mr.
Thank you
President.
very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very
Thank you
much.
very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to
Okay.
work with the Center for Disease Control. And we are up and
We gotta
running with
coordinate.
tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will
I
bring
don't know.
into our
Should you
facilities
let folks
this
know
weekend.
everything that's
And,
going on at this
I know
point,
myself
or
and us, my colleague
if some of the
at Labcorp
information you
will be
have may
doing
not
the
be
same.
accurate, do
So
you
the capacity
hold
available to the American public to
at
support
what
this
rate will you
action
update
with
people?
consumers will be
Maybe we can
considerably
start to set
increased
some
in the next
normalized
few weeks.
checkpoints
Thank
or
you, Mr.
things
Thank you very much. I appreciate
along
it.
this process. Just because I
And
keep
Matt
on
Sauce,
seeing
please, of
people
Roche.
don't know,
Matt, thank you, Matt.
and when people don't know,
Thank you, Mr.
that's
President.
terrifying.
So, from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the
A lot of
partnership
folks
with the
were
CDC
concerned.
and the
It's-
FDA to get that
things
to
were
market as fast
downplayed
as
and-
possible, because it's critical for us to
and
make that available.
Was this because
to
we
help
were
patients in
didn't
need
have the
and working with
accuracy of the
laboratories
test yet,
to get
or
it up and going in the near future?
was it
which will bring
mismanagement?
hundreds of
I don't know.
thousands of tests available to patients in need in the United States. So thank you.
You can
Well,
do it.
focus on
You can
solutions.
do it.
The
Great
Monday
company.
morning quarterback and
David
politics all we
Pierre of
want, but
Signify Health, please.
it's a people issue.
Thank you, Mr. President.
It's a human
We
issue.
are the largest house call provider in the U.S., and we go to the homes of the most vulnerable, elderly, and through our
Thank you.
network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Thank you.
And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. Some bad ones over the years, and I guess that'll continue.
One guarantee in
to an
life, and
extent,
that's
but we hope
there
it
are
never
no
happens, but
guarantees.
We're going to be
If you
changing a
tuned
lot
in from
of
the
old
start, that's what the Mach said.
rules and specifications and regulations. Adam Schechter,
Over
who's
30
really
years
been
ago.
of tremendous help. LabCorp, please. Adam.
Thank you,
All
Mr.
right.
President.
At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical
Hey, Andrew.
centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand
I
how
move
important
forward,
the testing is, and we
the
are
light
committed
actually
to
hits
doing
the green
everything
screen.
possible.
So my yellow doesn't blend in as much in the shadows. That's
Thomas
fascinating.
Moriarty,
Also, let me
CVS.
read my phone
You
over
all know
here to read the
CVS.
chat.
Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of
If you
making
folks
sure
have heard
our
anything
patients
else
and the
about
customers
any
we serve
data, any
have the information
findings,
they need, the
accuracy
safety
of
they need
tests,
as well.
if you
We are
find any
committed to
articles,
working
just
with the
let me know.
administration
We can
and
bring
local
it up
public
and
health
stuff, just
officials
because
to make this work as well. And thank you, sir, for
if
the
we can find a frickin' flag out in the middle of nowhere with the power of the
Bruce
internet,
Greenstein,
you're telling me we can't
LHC
figure this
group,
stuff out?
Tremendously talented people.
No
Thank you
way.
very much.
Mr. President, thank you for the honor of being
Continue,
here.
the
And
President
the home health industry has
and
been
his team.
treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help, to partner with our hospitals and physicians, as well as the people we have here today that will be doing testing around the country. Thank you.
Here we go.
Oh, we'll practice that.
Okay, I like that. That's
See,
good.
we're improving. We're working on it. I need
Also
a wider
announcing the
screen.
following emergency executive actions today. To help our students and their families, I've waived interest on all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are
It does,
left in the
but
middle right now. Many of those schools
folks
have been closed.
still have payments
Based on
and
the price of
everything,
oil,
so-
I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S.
Not a
strategic reserve.
Not a bad idea. Oil is
We're going to
tanked.
fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward
Not
that
a terrible
wonderful
idea.
goal which
A lot
we've
of folks
achieved,
don't always
which
see
nobody
oil
thought was
related.
possible, of energy independence.
Well, thank you,
It
Barack
puts us in a
Obama.
position that's
President
very
Obama.
strong, and we're buying it at the right price.
True.
And that's something that would have not even
I'm
been
sure if
possible a
MC's
week
listening,
ago.
he's busting a gasket right
The
now.
price of oil went down quite a bit, so we're going to fill it up. It's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please.
He's good at marketing. Fill it up. Fill it up. You call it a
Thank you,
virtue
Mr.
signal,
President.
but
It is. This day should be an inspiration to every American, because thanks to your leadership from early on,
unfortunately, a lot of folks. Are
not
scared.
only are we bringing
millions
a whole
and millions of people are
approach to
terrified right
confronting
now.
the coronavirus,
We have
we're
to
bringing an
acknowledge
all of
that.
America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries.
Now how
And
does that
on the
work?
unanimous
Doesn't the test
recommendation
take
of
like
your
2 or
health
3
experts,
days for results? Do you just kind of
at
chill
midnight
out the
tonight,
airport or something? Like
will
what is the
effectively
process?
suspend all travel,
These are the things that people
from
don't
Europe,
know
and
would
Americans
like
that
to
were
know.
returning will
I
be
mean, if you're just
screened,
gonna put them in like
and
a little
asked
room
to
with its own separate air
voluntarily
ventilation
participate in
system
a
and everything,
14-day
okay.
quarantine. Throughout this process, Mr. President, you put the health of America first, but you brought the best of America to address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued
This is
broad
the only
guidelines
thing that
from
people are
CDC
talking
for
about.
every
Well, not the
American.
only thing. That's
But this
fair.
week,
Not
at your
all.
direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida.
We can do better.
And we've been in continuous contact, as
Oh,
you
wait.
said, with governors around the country. Mr. President, you have forged
I'm
a
sure I got the
seamless
link to the
partnership
president's thing, not even my
with
own
every
thing.
state and every
What a
territory in this
noob.
country to put the health of our nation first. But today, I trust that people around the country that are looking on at
This is
this
why nobody
extraordinary
watches.
public and private
I'm
partnership to
just
address the
kidding.
issue of
I
testing
see all there. Hey,
with
nerdy.
particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need.
I'm so bad.
For Americans looking on, by this Sunday evening, we'll be able to give specific guidance on a White House Corona, on when the website will be available. You can go to the website, as the President said.
When it will
type
be
in
available?
your symptoms and be given direction whether or not a test
Are you telling
is
people to go to a
indicated.
website
And then at the
that's
same website,
not
you'll be
available?
directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come
Okay.
by and do a drive-by test. And Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens. These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and Roche, have just done an incredible job stepping forward, and they're going to literally make hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together not just government resources, which all state labs can now test across the country. CDC is testing. But you said, Mr. President, that we wanted to bring all the resources of the country together, and that's what this partnership really means. You know, the truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense.
It's about
practice
everyone
good
not getting
hygiene,
sick at the
go
same
to the
time.
CDC's
Oh, yeah,
website,
doing the
see
things
what the
that I
guidance
think a lot
is
of
for
us
your
learned, but we
community
never,
or for the American people broadly.
well, many
And
of
as
us
the President
didn't
has
really
said,
appreciate.
It's
I know
especially
I
important
slacked.
now that we look after
I'm part of
senior
the problem.
citizens with chronic underlying health conditions. Last week, the President directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were
what are
there
the
for
protocols
us when we
going
were growing
through?
up, Mr. President.
What?
They helped us with our homework. They
How are people
tucked
going to
us
go
in at
visit their
night.
family members?
They cheered us on
This
as
is-
we
this
pursued
is something that
education,
affects all
cheered
of
us
us.
on in our careers, and now it's time for us to be there for them
So,
and to recognize that seniors with chronic
For
pain,
tax
every
right now,
American
so
should
they're
be
literally
proud of this incredible
turning
public-private
away the elderly
partnership
for
that's going to
care.
be speeding access of testing to millions of
I'm
Americans
trying to avoid that,
in the
man.
weeks ahead. And together, as you've said many
I
times,
mean, it's
together
what do you do?
we'll get through this. Together we'll put the health of America first.
We'll do the best we
Seema,
can with what we
Seema,
got.
I'd like you to maybe take that a step further, please, on nursing homes. Thanks.
Thank you. Well, thank you to the President for the declaration. It allows my agency, CMS, that runs Medicare and Medicaid and has oversight of all of the nation's healthcare facilities, to suspend regulations that could get in the way of treating patients during this time. These temporary national blanket waivers are reserved for the rarest
temporary.
of circumstances,
Yeah,
and they
it's-
represent a massive mobilization of our country's resources to combat this terrible virus.
I don't know. People are
And the
scared. There's a
flexibilities
lot
we are
that can
offering
happen. It
will be a
just
godsend
does.
to the providers, clinicians, and
I don't even want to
facilities
say it.
on the
I don't
front
even want to
lines
say
of
what
this
it kind of
fight.
sounds like, but
And
at
later,
the same time,
CMS is going to be issuing guidance
We're gonna
directing
flatten the
nursing
curve.
homes to
Do
temporarily
we have a better
restrict
way?
all visitors and non-essential personnel,
Please show me a
with
better
a few
way.
exceptions such as end-of-life situations. We fully appreciate that this measure represents a severe trial for residents of nursing homes and those who love them, but we are doing
is scary for
what we
everybody.
must to protect our vulnerable elderly. Thank you.
All right.
As I said in my address
you.
to the nation the other night, all Americans have a role to play in defeating this virus. Our most effective weapon right now is to limit the damage to our people and our country and slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus,
Right. I guess.
reducing its spread and shortening the duration
The trick for toilet
of the
paper,
pandemic, which
just
is what it
visit
is.
a local gas
The
station. They
CDC
very
has published
often
guidelines on the
have a small batch.
coronavirus
It's usually higher priced.
.gov
I
to
grab a
enable
couple of
its
rolls, no problem.
coronavirus.gov. And it's very
It's because some
heavily
folks are
used
scalping
right now,
it.
I will say, to enable every
Remember
American
after
to
hurricanes
respond
and
to this
disasters?
epidemic and to protect
Oh,
themselves,
it's like,
their families, and
it's like
their
$7 to
communities.
$10 for
While the risks
a
to
12-ounce
young and
bottle
healthy
of water.
Americans remains
Why?
very low.
Because people can.
We've learned a
People
lot
are
about
desperate.
this over the last 2 weeks.
Welcome to
Anyone
supply
can
and
be
demand.
a carrier for the virus and risk transmission to
these are
older
the times
Americans
where
and those with underlying health conditions.
Maybe we should think
and
of our
those who are
fellow
most at
creature
risk.
as well.
They have not done
Be treated
very
how
well.
we would like
Older
to be treated, rather than just
Americans
making
who
a
are,
quick buck.
especially if they have a health problem, they have not done well.
Well, they call it the
We must
almighty
take all
dollar.
precautions
I
and
just pointing
be
it out.
responsible
Pointing it out.
for the actions that we take and that we see other people take. We want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, by that. That would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night my various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to.
You want to minimize
We need to
risk
be consistent in adopting measures to
anybody
limit
that
the spread of the virus. The
could
virus
be highly
is
susceptible.
the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go. You have some hot spots throughout the world right now that people would have never thought possible. They're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools. And we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense.
Right.
For the areas where the virus is spreading, the CDC is advising communities to postpone large rescheduled cleanings.
I mean, it's
and cancel work, sponsored
we're
travel.
we're doing a lot of things that
among
other places we're
numerous
doing.
other steps that can be taken.
If you want to go
Americans are
out,
the
you have to
strongest
have
and most
multiple
resilient
masks, this,
people on
that,
earth.
eye
And in the coming
protection.
weeks, we will all have
watched
to
a guy
make
do that a month
changes
and a
and
half ago.
sacrifices, but these short-term sacrifices
He
will
was in the
produce
area.
long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse, it could get worse. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through. In interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term. In times of hardship, the true character of America always shines through.
That's true.
We live in the company of the greatest heroes and the most inspiring citizens
Sometimes
anywhere
it
in
takes
the
times
world.
being at their worst for
We
folks
want
to
to
be
take
at their
care of
best.
so much progress has already been made.
I think the Brits say, keep
And
calm
frankly,
and
the
carry
numbers,
on.
because the steps that have been taken are at a level that a lot of people are surprised, especially when you compare them with other places with
Never
far
know.
smaller populations. The spirit and the will of our nation is unbreakable. We will defeat this threat when America is tested. America rises to the occasion. And to those families and citizens who are worried and concerned for themselves and their loved ones, I want you to know that your federal government will unleash every authority, resource, and tool at its disposal to safeguard the lives and health of our people. So we're with you every step of the way. No nation is more prepared or more equipped to face down this crisis. As you know, we are rated #1 in the world. We're also helping other nations. Many other nations, we're helping them a lot. And they're doing okay in some cases. In some cases, they're not doing well at all.
Yeah,
We're
no,
working with a
doing
lot
different
of
things.
groups of people and
I
a
know
lot of
South
other
Korea
nations. With faith and heart
clamped
and
down
hope
right away.
and love and determination, we will
Iran's
succeed.
getting hit hard.
We
Italy's
will
getting hit hard.
prevail. We will be very, very successful, and we'll learn for the future. Thank you all very much. If you have any questions, we can take some. Go ahead,
All
John,
right.
please.
We'll
And
take a
if you'd
couple
like
of
to ask
questions
some
and
of
we'll
the
probably wrap
folks
it
up
up
here
just
would be
because
fine, please.
really want to cover the
Mr.
president's
President,
remarks.
where are you with the House bill? Yesterday we talked to you in the Oval Office. You were opposed to it. What has happened since then, and what's the holdup on that?
Well, we just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all
This
of a
is the
sudden,
thing.
they didn't
I
agree
hear
to certain
some
things that
conservatives
they
say there
agreed
was
to.
pork,
So,
but now the
we
president's saying it's not
could have
enough.
something,
What
but we don't
what
think
is it?
they're giving
I
enough.
haven't
They're
read the bill. Probably
they're
I
not,
should.
doing what's
I
right
don't
for
know.
the country.
And if I could ask Dr.
Did
Fauci.
either of them
Go
read
ahead,
the
please.
bill? I don't know.
Thank you, Mr. President. You just mentioned waiving interest for student loans.
Yeah.
Right.
You talked about buying oil from the SPR or adding to the SPR. What other specific targeted measures is your administration thinking about taking? The
Right.
Treasury Secretary Steve Mnuchin said today that you're just in the second inning of
Yeah,
things that you
well,
might be undergoing.
That's true, and we are looking at many different things,
true. No,
as
there's
you know.
different
some
models
of
what
them
could
have been
happen.
written about very widely, but we're going to be releasing a paper in about 2 hours, stating quite a few other steps. very
Procedures,
important ones.
protocols,
Please
what's
go
up?
ahead.
What, sir, if you wouldn't mind?
Please go ahead.
Thank you so much, Mr. President. I wanna know if you are in contact with the Brazilian President Bolsonaro after a member of his delegation, who was with you Saturday, was tested positive. And also, I want to ask another question, if you let me. Senators Lindsey Graham and also Senator Rick Scott are self-isolating. Are you planning to take any kind of precautionary
potentially
measure
exposed,
to
yeah.
protect you and also your staff who was there?
No,
with him?
we have no symptoms whatsoever.
No symptoms, but I
And,
mean,
we
is
have-
the
we had a
test,
great
when's it
meeting
accurate?
with
Only when you have symptoms?
the president of
These are
Brazil,
other questions that
Bolsonaro, great
I'm kind of curious
guy,
about.
very tremendous. He's doing a fantastic job for Brazil, and as you know, he tested negative, meaning nothing wrong this morning, and we got that word too because
Well,
we
you
did
also
have dinner
don't
with
know.
him. We were sitting next to each other for a long period of time.
But are you in contact with him over the coronavirus
No,
crisis?
we're talking about it country to country, but we did discuss if he had a problem. It was reported that he may have it, and he doesn't, fortunately.
So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs
Yeah, so what's
a
going
test
on?
will
I was
be
hearing a
able
lot
to
about
have a
that.
test? What's the date of that?
Yeah, no, I don't take responsibility at all because we were given
This bothers me, but
circumstances, and we
Mr.
were
President, with all due
given
respect,
rules,
I thought
regulations,
the
and
buck stopped with you.
specifications from a different
I
time.
do kind of remember President
wasn't meant
Obama
for
saying
this
the buck
kind
stopped
of,
with him.
An event,
And then I think he
with the kind
maybe
of
kind
numbers
of
that we're talking
explained
about.
why and stuff.
And what we've done is
We still
redesigned it
expect you to
very
explain
quickly
why
with the
and
help of the
plead your
people
case,
behind
but
me, and we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday
this
night.
is what bothers people.
And this will start very quickly, and we'll have the
Was
ability
the red
to
tape?
do,
Was the old system?
in the millions.
That's what I think they kind of
over a very,
explained
very
later
quick
in
period
the
of time. So no,
thing.
and what
So
we
I
have
mean,
done, and we are going to be leaving a very
you
indelible
got to
print
be able
for
to
the
explain in a
future
way that people
in case something like
understand,
this
saying,
happens
listen,
again.
we had all these
But
precautions
it was
for
a-
these
and
specific
that's not the
scenarios,
fault of
basically a
anybody, and
large
frankly,
deadly
the old
outbreak in a
system worked
contained
very
area,
well for
not
smaller
a
numbers, much
widespread,
smaller numbers, but not for these kind of numbers.
moderately
Tony,
deadly,
maybe
but if
you'd like
everyone
to
gets
say
sick at
something.
once, it complicates the entire system, so those perhaps minimal cases,
So just to
or
reiterate
serious
what I
cases
said to
become
many of you
deadly.
multiple times, it's a distant of
I'm not a
system.
doctor.
The system was not designed for what it was designed for. It worked very well. The CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
And Mr. President, with respect,
Interestingly, if
What
you
if
go
it's not
back-
designed for what
yes,
comes
if
out
you go
next?
back
This
to
is
the swine flu.
saying the
it
system
was,
didn't work for.
nothing like this.
It
They
was
didn't
worked
do
for what it
testing
did,
like
but
this,
not
and
for this.
actually
And
they
in the
lost
future, it will work.
approximately 14,000 people,
Y-
and they didn't do the testing. They started
just
thinking
need a
about
little bit
testing
more
when it was far too late. What we've done, and one
Because
of the reasons I
it's
think people are
wrong,
respecting what
but
we've
now
done,
it
we've done
works
very
and will
early,
work in the
we've gotten it very
future.
early, and we've
Just,
also
I just need to know
kept
why
a
it's
lot
going to
of
work in the
people out.
future.
Mr.
That's
President,
just
the
me.
last
Go ahead.
administration
Please.
said that they had tested 1 million people at this point. You've been
Well, ask them
president
how
for
they did with the
3
swine
years.
flu. It was a disaster.
But with respect, you've been
Next,
president
please.
for 3 years.
Next, please.
You are
They had a
kind of
very
just
big failure
passive.
with swine flu.
Swine
Very
flu?
big
I
failure.
mean, well, I don't
President,
think
I want to ask you about the European
we shut down the
travel
country
ban
for
that
2 weeks.
goes
I'm
into
just
effect at midnight tonight, and the exemption
just
that
curious.
you've offered to the UK. There are 17 countries that are in the so-called Schengen
Oh,
zone
we always pick
that
nits
have
in that.
fewer
You know how it
coronavirus
goes, Mitch.
cases than the UK. And just in the past 24 hours, the UK has added 208
That's the thing. I don't have all the
coronavirus
information.
cases
I can give
to
my
their
initial
total.
thoughts, but
Why
it's
do they,
like
Mr.
I
President,
again,
deserve an exemption?
I am not
And
in
would you
those
consider
meetings.
adding them to this travel
I don't have all
ban list?
historical
Well, that
data
was
in front of me right
recommended to
now.
me by a group of
Maybe
professionals.
I should.
And we are looking at it based on the new numbers that are coming out, and we may have to include them in the list
Sure,
of
we can find these things
countries
out.
that we will, you could
Internet
say ban
academics,
or whatever it is during
assemble.
this period of time. But yeah, the numbers have gone up fairly precipitously over the last 24 hours, so we may be adding that. And we may be adding a couple of others, and we may frankly start thinking about taking some off.
I appreciate that he put that in there. We might actually think about taking those off.
With Hong Kong Phoenix TV.
All right.
You have mentioned that the number in China has been decreasing. China has made tremendous progress in the past weeks.
True.
I'm wondering how much confidence does this give you to control the virus in the United States? And do you see the data China has been sharing with the United States has been helpful?
I think it has been helpful. We've been working very much
There,
with
there was
China.
concern the CDC
Spoken,
didn't
as
go
you
on
know,
right
with
away, but then
President
again,
Xi. They
well,
went through
we are
hell,
not China.
and their numbers are starting to look very good. They're really looking very good. We're very happy about that. We are sharing data, yes. In fact, we're sharing quite a bit of data,
I mean,
including
that's,
the fact that
I
some
mean,
of
that
our
sounds good.
pharmaceutical companies are working over there right now with large groups of people.
All right.
Yeah, go ahead, please.
Hey, Spinal
Thank you,
Tap,
Mr.
tap,
President.
tap.
You spoke with Canadian Prime Minister Trudeau yesterday.
Yes,
Did you discuss
Oh,
the potential closing of the border between Canada and the U.S.? And by extension, are you considering ways to
These are
salvage
good
the $2
questions.
billion daily trade between the two countries?
So
It's
his
about
wife had
1
not been
month
diagnosed,
of global
and she's
production.
a lovely lady, wonderful
Just
lady, great lady.
in my respect,
And,
that's probably
since
what,
then
like
I've
8.5% or
read
so percent.
That the result
If
was
you
that
take the market
she
being at
hasn't.
about 29,000 going
And
down
I
to
was a little
23,000,
surprised.
if
I
you
think
put
he was
23,000
surprised.
and
So we did discuss
29,000, it actually
prior
comes
to,
out to be right about
she's going to be
10.5%.
fine, but he thought that she.
I don't know. I
would
don't
not
have all
most
these
likely
billions of data points in
have
front of
the
me. I don't have supercomputers and
virus.
algorithms. All I know is
Unfortunately, she does. But we
if
did
more or less
discuss
things
the
are going to be
border
closed for a month, why don't we just take
Go ahead,
1/12 of that off?
If you have any questions for these
Is it
great
accurate?
geniuses,
Probably not
up there, you
perfectly,
should
but
be- even a business question.
is it accurate
related
enough?
to what we're talking about?
Mr.
Maybe.
President, Ross Palumbo from ABC
Just
News
curious.
Miami. As a relatively new Floridian, what is your message today to the cruise line industry and the travel industry that Florida depends upon? And since Senator Rick Scott and
That's the
Miami
thing, Mitch.
Mayor
How do
Carlos
we tell
Menes
when
have
we're
the
just doing
same
immediately or
exposure as you, and they
actually
are
trying to do certain
self-isolating?
things?
What's your
Do we need a
message to
scale
them
of
that they shouldn't be?
sarcasm there just so
Well, I don't
people
know
can
that I had
understand? I
exposure,
don't
but
know.
I don't have any of the symptoms.
It
and
might
we
be
do have a
telling.
White House doctor, and I should say
If
many
all of a sudden
White
you're
House
like,
doctors to, frankly,
I'm one,
and
stone cold
I asked them
serious.
that same
I'm 7.
question,
I'm
and they
completely
said,
sarcastic.
you don't have any
It would
symptoms
be interesting to see
whatsoever.
the
And
reaction
we don't want people without
and how
symptoms
people
to
shift
go and
depending on the
do the
situation.
test. The test is not
Because now that it can
insignificant.
explain, oh, I was just
As
bullshitting,
far as
or
the
oh, I was
cruise
being
line
completely
business, we're with
serious.
them all the way. It's
I'm
a
just
great
curious
business.
how
It's a
different
great US
situations would
business
play
with
out
them.
if you actually had a metric to
And,
measure it by as
I know how
well.
important they are to the country.
All I'm
It
saying.
includes airlines. But
Of course,
the
I'm
cruise
gonna say
line
more.
business obviously was hit very hard. We had a tremendous success out in Oakland where we moved it. Vice President Pence did a fantastic job with that. We worked with UK. We worked with Canada. They took their people back in Canada. It was approximately 600 people. UK likewise took a large number of people back to the United Kingdom. And we have people quarantined. It was a big operation, and it worked out really. You don't hear about it anymore. It worked out really well. Mike, you may want to say something about that because that was really done properly.
What did he say again?
Well, thank you, Mr. President, and that program,
The old sales
Grand
handoff.
Princess, the ship, is
Well,
continuing
it's a
to
topic.
be
10
administered
years
in
corporate sales will
highest standards,
give you
orderly
anything of
way, as the
sales.
President directed, and Americans that needed treatment have received them. I spoke to the governor of Iowa
VP
today,
Pence
and,
was actually on
some
TV
of
when I was
those who
landing
now
in
have
Fort
been
Lauderdale while he
cleared
was in
are-
Fort
are
Lauderdale.
able, in proper supervision, to be returning to Iowa. They're making arrangements for them to do
Oh,
that.
Vice President's
Others in
here.
Texas,
Cool.
others in Georgia. Again, it's another example of the extraordinary cooperation. Governor Abbott, Governor
Maybe that
Gavin
should have been a
Newsom,
sign.
Governor
All I
Brian
know is
Kemp,
I'm
of
out at a
Georgia.
bar
But
on the
to add to
A1A
that,
with
the
a buddy from
President,
Miami.
directed me
They're
last
having some
Saturday to
beers. All of a
travel,
sudden, girl comes up. She's
down
like,
to Miami.
Corona's having a
Met with
free
all the
Corona
leaders
promotion
of the
tonight. I'm
cruise
like,
line
oh,
industry.
really?
Several cruise
Can
lines
I take a
have
picture?
announced,
Sure.
a 60-day
And approximately
pause,
12 hours
in
or so later.
operations.
the governor of Florida declares a state of emergency. I'm like, oh,
praised them for
that was
doing that because
some
of the
interesting
unique
timing.
health challenges.
8 hours later, my home state governor declared the state of emergency. I'm like,
seniors with underlying conditions.
all right then.
We have a proposal
Opens up the
from
federal
cruise
aid.
line
Here's the
industry,
thing.
but
Hitchhiker's Guide to the
they're
Galaxy
currently
lets us know.
considering what other steps that
Don't
they might
panic.
take, perhaps even similar to what those other lines have taken. We're anticipating some response on that in the next 24 hours. But as the president said, the American people cherish our cruise line industry. The men and women who work on the ships, men and women who work on the shore.
No, it's a lot of jobs. What happens to the folks that I know? A lot of folks, they're opening up actual
directed us to do
emergency pay. A lot of big corporations, but what about everyone else? Where it's like, oh yeah, you can't go to work.
We all continue to discuss.
This,
we want to work with the cruise line industry to ensure
people.
that when we come through this,
and when other people get scared, too many other people get scared, then that can cause other people to get scared. It's
passengers and
kind of like
all of the crew,
a fear ball effect.
Cruise lines are safer than
like
ever
a snowball,
before and can
except
prosper
it
for many years to come.
seems to act even more irrationally at times.
Go ahead, please.
This question is for Doctors Fauci and Birx. Dr. Fauci, based on what you currently know, what is the trajectory for when this outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx,
very hard to say.
As the administration tries to get its arms around this test,
could be conservative, but then again, it
could be respirators and related
could
hospital equipment. So
the
what is the
respirators.
administration doing right now
that's a good
to
point.
ramp up production of respirators and that kind of equipment? Should
Element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several weeks and then down again over other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate for me to mention it again because it answers your question. When you talk about preventing infections from without in, which is the kind of travel restrictions we're talking about, then how do you handle what you already have in your country? You continue some sort of containment, but you also do mitigation. And you try to proportion it to the areas where there are the most infections. The success of that and how much you make this turn into this is going to give you the amount of time. If we're successful, it'll be less. If we're not successful, it's going to be more. But these kind of things generally run out in a few months. Hopefully, we'll make it several weeks, 8, 9, whatever weeks. But I can't give you a number because it depends on how successful we are.
Great, thank you. It's a great question, and Dr. Fauci and I have worked together a very long time and continue. It's a privilege to work with him every day. So I think you can learn and I appreciate there were some graphics done by some of the reporting over the last several days.
So
if you align the data for...
We'll kind of go over there. The actual full conference, it basically goes on for like another 20 something minutes there. The president spoke for probably, with his advisors and stuff, probably around 35-40 minutes there. We got some additional questions. I'll toss the link in the chat right now in case anyone wants to check the rest of it out. You just go to the White House YouTube channel. It's all loaded up there. I think this is important. And the reason why I say that is because a lot of times we'll bring up issues, we'll argue about issues, we'll complain about issues that do affect people, but very often it affects different folks from different strokes depending on which blokes are involved. Dudesettes. Hey, Ed. No, I'm just wrapping up. I was just giving commentary to the president's remarks. I'm stopping right now because I don't know, maybe this is the last night I can actually go out and enjoy myself for a while, and I don't know, may have a brewski or two. So before it gets too late, I did want to have that opportunity, but I also, upon listening to this, I listened to I think almost all of it. I think I put down my headphones to go do something for like a minute or two to set this up, and then as it wrapped up, the big thing is, from what I can tell, the response is a thing. You can Monday morning quarterback everything for everything. But the thing is, at this point, this is affecting everyone. Doesn't matter who you are, this is directly affecting people. Not just, okay, this will affect a certain amount of folks within these groups. They're going to shut down the country for 2 weeks. I don't know about you folks, but I don't remember the last time the country was shut down for 2 weeks. What I'm being told is essentially you're going to have your pharmacies and grocery stores open, or at least some within there. That does kind of remind me of like some holidays we'd have where basically everything is closed except you'd have like a supermarket and a gas station or something. The gas station is another thing that does kind of concern me. So I'd say make sure your tanks are topped off and everything. I mean, you're probably not going to be doing as much driving if you're not going to work. Medical professionals, of course, they still have to go to work because the big thing is to normalize the number of folks. Because here's the thing. There are people that, regardless of coronavirus, are sick. We are still within the greater flu season and everything as far as I know. Again, I'm not a doctor or health professional, but from what I can see, it's just, okay, we're at a time in the year where very often our healthcare resources are at capacity or near capacity. If all of a sudden we get 500,000 or 1 million or 4 folks get sick, a lot of those cases may be decently mild. But if you have so many of them, and there's a certain percentage of those that are serious, if those serious cases are greater than the amount of healthcare resources that we have, then unfortunately we might start to end up like some of the situation in Italy, where literally they're turning away older folks with underlying conditions and stuff and saying, listen, we don't have the resources to care for you right now. And you're starting to see a surge. I heard something about a couple hundred deaths in Italy just either yesterday or today. And that's what we're attempting to avoid, because people can get sick. There will be people that die. Every death is a tragedy. But as the Macho Man at the beginning of the stream said, the one guarantee in life is that there are no guarantees. Because we can do everything we want to try to control the future. None of us the almighty. We can only do the best we can to maximize our chances in a given situation. And this is an unforeseen situation that many of us even kind of paying attention to that have been watching. This isn't what I expected to happen. Was it a possibility? Sure. But then again, I also thought of President Trump was just a possibility. Here's the thing. Anything can happen. So I think we should try to level up, because I think we can truly do better. But hey, thank you all for coming by and watching my my little ring-a-dig broadcast, and peace out and be safe, everybody. And then if I go to the right screen, I can actually end the thing. Oh, we hit the end stream. End screen, everybody. Bye.